Maintenance and cleaning during a designated outbreak. Disinfection methods and schedules. Objects that are touched repeatedly by multiple individuals, such as door handles, light switches, control buttons and levers, dials, levers, water faucet handles, computers, phones, or handrails, must be cleaned frequently with an appropriate disinfectant. Surfaces that are handled less often or by fewer individuals may require less frequent disinfection. The disinfection methods and schedules selected are based on specific workplace conditions. The New York State Department of Environmental Conservation, DEC, and the Environmental Protection Agency, the EPA, have compiled lists of approved disinfectants that are effective against many infectious agents. Select disinfectants from DOH and CDC and follow manufacturer guidance for methods, dilution, use, and contact time. Adjustments to normal maintenance cleaning procedures. Normal maintenance duties and schedules should continue to be followed during an infectious disease outbreak, to the extent practical and appropriate, and consistent with Department of Health and CDC guidance in effect at the time. However, routine procedures may need to be adjusted, and additional cleaning and disinfecting may be required. Maintenance cleaning staff may be at an increased risk because they may be cleaning many potentially contaminated surfaces. Some maintenance cleaning activities like dry sweeping, vacuuming, and dusting can resuspend into the air particles that are contaminated with the infectious agent. For that reason, alternative methods and or increased levels of protection may be needed. Rather than dusting, for example, the CDC recommends cleaning surfaces with soap and water before disinfecting them, and conducting maintenance cleaning during the off hours may also reduce the other workers' exposures to the infectious agent. Best practice dictates that housekeepers should wear respiratory protection. See the cdc.gov for more guidance. Now, if an employee develops symptoms of the infectious disease at work, it is ideal to isolate the area in accordance with the guidance issued by the New York State Department of Health or the CDC before cleaning and disinfecting the sick employee's work area. This delay will allow contaminated droplets to settle out of the air and the space to be ventilated. As feasible, liners should be used in trash containers. Empty the containers often to prevent overfilling, and do not forcibly squeeze the air out of trash bags before tying them closed. Trash containers may contain soiled tissue or face coverings. Now, if an actual or suspected infectious disease case occurs at work, take the following actions. Instruct the sick individual to wear a face covering and leave the work site, and follow New York State Department of Health and CDC guidance. And then follow local and state authority guidance to inform the impacted individuals. The Administrative Operations Director will verbally inform all employees of the existence of the location of this plan, which should be posted, by the way, in all buildings, and the circumstances that it can be activated, and the infectious disease standard, employer policies, and employee rights under the HERO Act. Note, training need not be provided to the following individuals: any individuals working for staffing agencies, contractors or subcontractors on behalf of the employer at any individual worksite, as well as any individual delivering goods or transporting people at, to, or from the worksite on behalf of the employer, where delivery or transport is conducted by an individual or entity that would otherwise be deemed an employer under this chapter. Now, when this plan is activated, and it has been, all personnel will receive training which will cover the elements of this plan and the following topics: infectious agent and the disease it can cause, the signs and symptoms of the disease, how the disease may be spread, an explanation of the exposure prevention plan, the activities and locations at our worksite that may involve exposure to the infectious agent, the use and limitations of exposure controls, review of the standard including the employee rights provided under Labor Law Section 218B. And this training will be provided at no cost to employees and take place during work hours. If training during normal work hours is not possible, employees will be compensated for the training time with pay or time off. Appropriate in content and vocabulary to your education level, literacy, and preferred language, and also verbally provided in person or through telephonic, electronic, and other means. Retaliation protections and reporting of any violations. The neighborhood center or his or her agent or person acting as or on behalf of a hiring entity or the officer or agent of any entity, business, corporation, partnership, or limited liability company shall discriminate, threaten, retaliate against, or take adverse action against any employee for exercising their rights under this plan, including reporting conduct the employee reasonably believes in good faith violates the plan or airborne infectious disease concerns to their employer, government agencies or officials, or for refusing to work, where an employee reasonably believes in good faith that such work exposes him or her or other workers or the public to an unreasonable risk of exposure, provided the employee, another employee, or representative has notified the employer verbally or in writing, including electronic communication, of the inconsistent working conditions and the employer's failure to cure, or if the employer knew or should have known the consistent working conditions. Notification of a violation by an employee may be made verbally or in writing and without limitation to format, including electronic communications. To the extent that the communications between the neighborhood center and an employee regarding a potential risk of exposure are in writing, they shall be maintained by the employer for 2 years after the conclusion of the designation of a high-risk disease from the Commissioner of Health, or 2 years after the conclusion of the Governor's emergency declaration of a high-risk disease. The neighborhood center should include contact information to report violations of this plan and retaliation during regular business hours and for weekends or other non-regular business hours when employees may be working. This concludes the training of the infectious disease control plan, and additional trainings regarding said topics will be forthcoming.